Hi, I would like to start this video by saying that I am not a medical doctor, nor am I any kind of medical health care provider. And so the things that I am talking about today have a lot to do with neurology. They are from experience that I myself have had and learned about by pursuing a lot of doctors and educating myself. And this is regarding the subject of migraine. Many folks deal with migraine and don't even know that they are. They tend to be hereditary, and oftentimes people think that they didn't end up with the same migraine issue that maybe their mom or their sister or their brother or dad had because they're not laying inside of rooms, hiding from the light, unable to get out of bed, vomiting uncontrollably with severe one-sided head pain. Well, that is true for a lot of people. Way too many people suffer greatly with them. Oftentimes, because those symptoms, the symptoms of particularly head pain, can be completely missing in migraine, because that is only one of the many symptoms of migraine. They are missed, and oftentimes they are missed even by neurologists. So, welcome to my journey. Many years ago, I had gone through a really big stressor. And in addition to that, I was going through the midlife changes that women go through. And I started to have frequent bouts of really bad head fog where I just could not think straight. It wasn't so much not the kind of head fog where you can't balance a checkbook or do math or that kind of thing. But it felt like my head was just socked in with cotton. It was so disturbing, kind of surreal. It was really hard to describe, but really uncomfortable, day upon day upon day. And I started getting spells of dizziness and being off balance. I would walk around a corner and feel like I was kind of lurching. Sort of like that feeling if you got one of those shopping carts in the store where it wants to veer one direction. It felt like that, and so my balance was affected by it. There were times where it felt as though my movement was not entirely synchronized with my brain, and I'll explain that like this. I don't know if you've ever seen any of these, the old movies where the voices and the actions, there's a slight delay between the voice and the action. That is how it felt with my movement and my brain. It's like I had this slight delay. And how do you explain that to someone? And well, it's not life-threatening. It was weird. And I knew something was wrong. I was having severe neck pain and stiffness, and it would feel like something had actually attached itself, clamped onto the back of my neck. And so that caused me to look into chiropractic. It wasn't anything out of line in my neck. I sought out ENT to see if there was something going on. I even had balance testing done. I didn't have anything that would really point to the symptoms that I was consistently having. I would get blasts, and I still do at times, where in one ear where it's like this crescendo, this really loud me kind of a sound, and then it kind of gradually faded away. And as I'll explain later on, once you start to be able to ferret out what these things might be, you tend not to be as troubled by them. And so I would develop spells of what I call, I have pet names for these things, squirrel brain, where when one of these attacks would hit me, I would come in, maybe be bringing groceries in, set them on a counter, start to put them away, and lose them. Okay, by the time I went to the fridge from the counter, it's like, wait a minute. Okay, what was I bringing over here and why? Normally my memory is super sharp. And I just call it squirrel brain. Couldn't remember really short-term things. It's more extreme than going into a room and going, shoot, what was I here for? I think most of us do that sometimes. This is like that on steroids. It is comical. While it wasn't funny, now I look at it and I go, well, I know what that was all about, because it would be a spell. It would be a spell a day or two before or the day of. And what we know about migraine is that one of the other things we know about migraine is that there can be several stages that they go through, and I will go into those in another video. What I'm doing right now is I'm trying to give a quick overview about some offbeat symptoms that are variables in those migraine storms. I call them storms because that's what they felt like and feel like when I go into them. There is a sensation sometimes where one of these is coming on where it feels like the neurological version of somebody pouring water on a switchboard. I will feel like all of a sudden everything just starts to blink out, where it's like a shutdown process, one little thing or one little neuron at a time. And no, I don't pass out. There is a type of migraine where folks do, but that's pretty unusual, although not impossible. I will sometimes get a sensation that I'm in an elevator and it is dropping, like a quick little right before it hits the bottom. It's usually super fast, maybe happens 2 or 3 times a day when I'm in one of the throes of these things. There is a sensation, I call it the hit in the head feeling. And this doesn't come with head pain for me. This feels like the feeling that you might have if somebody hit you in the head with a frying pan without it hurting, but you still feel like somebody rang your bell like that. Super disconcerting, of course. and it definitely, that something is very, very off. I can get a runny nose with it and not have a cold. Oftentimes the runny nose is on the same side as where the migraine is. If I do get any headache at all, it is typically for me on my right side, right around here. And that side of my nose will run. And the ear thing, strangely enough, when I get those ear blast things I was talking about, they will be in my left ear. They'll be on the opposite side of where the headache will be if I do develop the headache part. So you can have your teeth ache because it's all connected with this trigeminal nerve, which is impacted by the neurology that is going on in your noggin, causing the migraine storm. There will be times where it feels like I'm looking through static or sandstorm kind of, or I see like what they call visual snow. I think it's common with a lot of people. I don't think that mine is all that noticeable. Some folks have it quite frequently where it looks like it's snowing. Or static on one of the old-fashioned television screens before we had really good reception. There are times, and I'm not alone in this, where people feel, or they think that they smell something, and it's not there. I've had times where I was up in the woods on my trail hiking, and I was like, why am I smelling burnt tires up here? That is just the weirdest thing. And when I got home, I still smelled burnt tires. Now, then it started to dawn on me that, well, it wasn't really burnt tires. It was my brain telling me that there was some smell. And, all bets are off when it comes to a migraine brain. It's like scrambled eggs in there. I just feel like somebody's in there throwing confetti around, and anything is possible. There are times where I have experienced, now this one I have to make sure that I tell people, again, I am not a doctor. And if you have this experience, you really need to check it out. But I am not alone in this. I've also read others who experience shortness of breath. I sometimes, when I'm having one of these spells, one of these migraine attacks, I will have shortness of breath. I will have a day where I feel air starved. Now, aerobically, I am very fit. And I've had pulmonary testing done, heart testing done, everything. Everything has been negative as far as there being any real reason. And what we've concluded is that it is part of the autonomic nervous system, which controls respiration, blood pressure, heart rate, all of that. And for some reason, mine gets switched on and it causes me to feel like I need to take deeper, breaths. I feel like I don't have enough oxygen when I do. I'm not entirely sure why it decides to do that sometimes, but for me, that is one of my symptoms. I can get pretty significant belly aches, like low abdominal aches. I don't think that's unusual at all. But along with mine, I will get shivers. I will have these shiver spells. And for the longest time, I was like, why am I getting the flu again? Well, it's not the flu. What it was is that, the gut-brain connection is very real, as we're learning more in science. And the shiver spells, I assume, are part of that autonomic nervous system being switched on and kind of scrambled. But those two things tend to go hand in hand with me. When I am going to have belly ache pain, it's usually kind of low abdominal pain for me. I'll get shivers with it at the same time. And that can go on for an entire day. I think that sometimes I'll have a series of days like that. There can be Alice in Wonderland syndrome. Now, this one is a trip. I didn't get this one very often, and I haven't had this one for quite some time. But one morning I got up and I went and I looked out the window and I told my husband, I said, it looks like the backyard is turned at an angle. And he just looked at me like maybe I was going Looney Tunes, and I felt a little Looney Tunes, but my perception visually was the yard had shifted. And there have also been times when I have felt like part of me isn't quite the same. It feels smaller or bigger, and it sounds really, really weird. And intellectually that it's not true. I mean, you're not convinced that this is really the way it is, but it just has a sensation. And I guess I think it's C.S. Lewis who wrote Alice in Wonderland. He was a migrainer, and that is what he was talking about, the small and the large. I think that Alice grows really big in that movie. I don't recall. I'm not an Alice in Wonderland fan. That movie kind of freaked me out when I was a kid. So anyway, that's up beside the point. But Alice in Wonderland syndrome can be a vast array of symptoms that change a person's perception of either things around them being bigger or smaller or different, or themselves. And it can be really unsettling if you don't quite know what to pin that on. But it can definitely be a migraine symptom. Allodynia. Now this one is weird. They're all kind of weird, but allodynia is when you have a sensitive area on your skin for no good reason. It feels like you've got a sunburn somewhere, and it can be, some people get it on their scalp, on their face, or whatever when they're having a migraine. Oddly, mine is never on my face, or well, maybe once, or my scalp, but what I'll get is like a feeling on the back of one shoulder that feels like, holy smokes, how did I get a sunburn there? Or you feel like somebody has kind of used sandpaper on you. And you brush against it and it hurts, and it can go on for, a few days. Usually not very long, but it happens oftentimes prior to somebody coming down with a migraine. And it's just weird, weird things like that. It's, I think a lot of people suffer that to a pretty extreme extent. With my migraines, it doesn't always happen, but it's been frequent enough to where if I notice that going, I'm like, well, we know what's coming, right? And then yawning for no reason. Now, you yawn when you're tired, Yeah, if you didn't get a really good night's sleep the night before, there's a lot of reasons that we can yawn. But this kind of yawning is crazy because it's like you're forced to yawn. And it'll go on and on and on. One time I was over at my daughter's house, and my grandson said, "Grandma, why do you keep yawning?" It was almost embarrassing because it was frequent, constant, ongoing. You can't do a darn thing about it. You just get stuck in this yawning thing. Frequent urination can also be a symptom of an impending migraine. It's like everything sort of shifts and switches on and switches off, and that is one of those things that you may find that you have to go use the toilet really, really frequently. And you're like, I'm not drinking this much. What is this all about? And there's a lot of theories on why that might be. I won't touch upon that in this particular video. I'll probably save that one for different schools of thought and treatments that people have pursued. Colors can appear kind of washed out. When you have a migraine, like lighter color, I've had occasions, not super often, but where the colors look like somebody sort of faded them out for a little while. A lot of folks get these visual, I think they call them cytomas or something. I can't quite pronounce that, but it looks like geometric shapes that will go across the field of vision and eventually just kind of go away. And that's what a lot of people refer to as an aura, which a lot of migraineurs have an aura with a headache some of the time, but not always. That is one sign for some people. But my presentation, the reason that I'm bringing this up, is very different than a lot of people's, or maybe not as recognizable. Here's the thing. I did go in and pursue diagnosis for something because I didn't know why I was having these vertigo, dizzy spells. I didn't know why I was having the brain fog. I didn't know why I felt so out of it. And I also had what I call this feeling of dish rag, where I typically am one of those people that has super high energy, and that's just my baseline. And I would have spells where it felt like I had turned into a dish rag. I can't describe it any other way. You feel like you're just wrung out and dragging. And it's almost like your head feels really, really tired, like you just want to close your eyes even if you're not sleepy. It's the strangest thing. The rest of my body felt like it was fine to keep going, but it was like from my neck up, everything was asleep at the switch. It was just, like I said, it just putting all these things together, it was just weird. And so I did pursue, like I said, looking into it. And the strangest thing about this is that the neurologist that I saw, and I saw him for several years, completely missed it. He kept thinking that I had something wrong with my neck called cervicogenic dizziness, I think. And it wasn't that. And the vast majority of the time that people have neck pain and weird symptoms like this, it's migraine, because the neck pain it isn't what's causing migraine. Migraine is something that manifests with neck pain for a lot of people. In fact, I think it's quite common. So I think rather than, I have a neck problem, therefore I have a migraine, it may be more for many folks that the migraine is showing up in the neck first, and stiffness and really just a sore neck. And then you start to oftentimes get the other symptoms that go along with it. I have a sister that suffers with these too, and she also has a very atypical variant and presentation. She tells me that sometimes it feels like she's been shot in the back with darts. Not painful, but just like she just goes down, and she just actually has to go in and lay down and sleep it off for a while. She gets them a lot more frequently than I do, and I have a feeling that as she gets her way through midlife, it'll probably kind of simmer down a little bit, because migraines can be impacted by many, many things. And if you have a predisposition for them, it doesn't take too many variances to trigger them. So anyway, mine were hiding in plain sight. They got missed by a neurologist. They got missed by the ENT. They got missed by a chiropractor. Oddly enough, it was a completely different type of doctor that kind of offhand, I said, there's these spells that I get where it feels like something just kind of weird comes over me. And then I get really bad brain fog and I feel like I can't see straight. And he looked at me and he said, that sounds like you're having a migraine. I said, but I don't get really bad headaches. He said, no, a lot of people don't, and they miss them. They are misdiagnosed. But apparently his mom had something very similar. And she, in fact, he shared with me, had what I think are probably called hemiplegic migraine, where she would go completely numb on one side of her body. Now, that's scary because, of course, that looks a lot like stroke. Again, if you have that, you need to see a doctor, rule out stroke. I mean, a trip to the ER for something like that would be in order if that's your first time around with something like that. But do be aware that they can manifest in a lot of really weird ways. And I was fortunate to have this particular gentleman catch this, because then the puzzle pieces started coming together. I went home, got online, and started to go to reputable sites. And one of the best ones I found was called migraine.com. migraine.com. And there was a plethora of information. There are numerous sites, migraine.org, I think. There was one called Migraine Trust. But migraine.com, I felt like really was a pretty darn good resource as far as symptoms. And there would be people that would blog on there that had a really good knowledge of it. It's not run by doctors, but it is moderated. Things don't get too far out in the weeds, tinfoil hats and stuff like that, because when people suffer, there are others who can prey on that and promise things that are, not deliverable. So there is that. But hands down, the best thing that I ever did is I ordered a book by Oliver Sacks, which is, he's a neurologist and brilliant writer. I think he has since passed away. But it's called Migraine. And this book, I read it, and I kind of nerded out a little bit. I tend to be a researcher just by the way that my brain works. I love to, if I get on a subject, I'm going to learn all about it. And this thing answered so many questions about things that I had felt. Just this stupor feeling that I would get with these things. And he even said that these things are migraine or migraine-like, and the headache need not even be present. This is the takeaway. Migraine is not a headache. A headache is one symptom of this particular phenomena that we refer to as migraine. So any of those symptoms, when they are put together in a constellation, a good doctor can help you ferret it out. And what I would suggest is just kind of keep track of what these things are. If you're experiencing some of these weird symptoms and they seem to come in batches, and they seem to kind of work or interconnect with one another, ask yourself the question if it's possible that you are experiencing something that feels like it could be under this umbrella, and pursue talking to somebody until somebody listens to you. I think typically with the medical profession, which is wise, they will typically rule out anything underlying which could be, that we need to have treatment, and be looked into as far as, something that was risky or dangerous. Migraine, I still believe, I think it is still true, is a disease of exclusion, meaning they exclude all the other scary things. And then if, things align, then they go, yeah, this is likely what it is. And like I said, many of us don't follow the cookie cutter mold. And it was very helpful to me to have answers for what it was that I was experiencing. Now, I still experience them, but I didn't feel as thrown off the horse by them, because like I said, my situation was, and still is that, yeah, sometimes I can get a pretty good headache with it, but it is unusual for me to even take an ibuprofen. I just kind of power through it. I've never been waylaid and vomited and had to lay down in a dark room. That's not the way that the presentation is for me, thank God, because there are really a lot of people who suffer greatly, and I don't envy them at all. And as an aside, if you know somebody that suffers like that, believe them. Believe them. Don't doubt them. Don't dismiss it, because there are folks who truly, truly suffer. Men and women and children. Anybody can be susceptible to these things if they have the predisposition. So anyway, more to come. I would really appreciate hearing feedback of any of the strange symptoms that you might have with migraine, or if any of this kind of resonated with you or was helpful in any way. This is not the entire list of symptoms at all. I will probably redo another or come up with another video that will include even more. This was just a quick little scribble down. Like I said, I have two sisters that have them. One sister in particular has some really bizarre symptoms like me. Oh, last one I want to share. The Wicked Witch of the West feeling. And this is when you feel like you are melting into the floor. You're not hot, but it feels like do you remember the Wicked Witch of the West in The Wizard of Oz, how she goes, I'm melting, and she kind of withers away, but you feel that way on the inside. And that is one really lovely symptom that can also happen, or at least it does for my sister and for me on occasion. So anyway, power on and take good care. Thanks. Bye-bye.